Well, Australians are now able to get a new updated COVID booster vaccine. Health authorities are advising people to make sure their vaccines are up to date as infections rise. Joining us live now is epidemiologist Dr Clay Golledge. Dr Golledge, good to see you. Thanks so much for your time. Now, for a number of years, we've had a chat on air at around this time, and there's been a threat of a COVID wave ruining Christmas. What's the story this year? Have we seen an explosion of cases over the silly season so far?
We haven't really, Ash, at all. And, we had this conversation in 2022 when things were a little more dire. We said it won't ruin Christmas. Again, in 23, we said the same thing. And we can confidently predict, even more confidently predict, that in 2024 things are going to be fine. I saw a terrified journalist, John Flint, I'm going to name him, writing for the West, who always takes the position of extreme negativity when it comes to COVID. Say that we've got an explosion of cases. Well, if COVID's learned to avoid patients that have private health cover, we're not actually seeing it. We've only got a handful of cases in. Nobody's really sick. We haven't had a COVID death that I've been managing for over 2 years with someone who's been otherwise not seriously unwell, and it's behaving just like flu in many ways and relatively mild. And most of our COVID cases have other things wrong with them anyway. There's one patient in intensive care at another Perth hospital with a lot of other comorbidities. So all in all, things are travelling very nicely.
Well, that's exactly what we want to hear. Tell us about this new booster formulation. Is it much better than older versions? Is it worth checking it out, rolling up the sleeve?
Yeah, JN1. So Pfizer produced a new Comirnaty vaccine, JN1 vaccine, which is a little bit more active against circulating strains. And look, if you're over 75 and you haven't had a booster this year, or you've got bad immune suppressive conditions and you feel like doing so, go ahead and have a booster dose. I think going forward, though, what would be much more attractive is to try and combine a COVID and a flu vaccine and actually just have that once a year for all of us, particularly people in healthcare as well, to do something like that. But is it much better? No. Is it marginally better? Yes. But have it if you are at risk and you feel like having one. But I'm not strongly recommending it to anybody, really.
And when we look at vaccination rates, I assume these are still being tracked somewhere. I remember the days when we used to put up on the screen during the pandemic how many Australians had been vaccinated that day, and we were all very focused on that. In terms of people who aren't in that older age group that you just referred to there, are many people staying up to date, or has enthusiasm really been waning as time goes on?
Oh, very much waning. So there's only a small percentage of people who you would say were completely up to date. If you say up to date being two injections a year for people at significant risk, then there's less than 15% that would be filling that. So now we're well behind, and we look really, because the virus is behaving in a relatively benign fashion, I'm not saying that we need to go ahead and have boosters. Look, for me, I've been infected 4 or 5 times this year because we just see so many patients with COVID these days, incidentally, often as incidental findings. And, I haven't been sick with it, but there's no point in me having a booster because I've just been getting the virus so often, which a lot of us in healthcare that see lots and lots of patients each day do get. So we're getting natural immunity, natural protection. And of course, people out in the community are counting the virus all the time and not even knowing about it. So at the moment, with our current status, I honestly do not think that it's a big deal to go out and get COVID booster vaccinations. And unless you, as I say, you feel like doing so, I'd never stop you from doing it. And you do fall into defined risk groups.
And now, Clay, from our chats in the past, I know that you've been a bit of a long COVID skeptic. I saw some research out recently suggesting that the virus can persist in our bodies for years after infection. Do you think the average person needs to be concerned about that scenario you just mentioned, you getting the virus 4 or 5 times this year, about the impact that can have on people's health longer term as we all do start to notch up more and more infections over the years?
Yeah, and look, there's a number of viruses besides COVID that can cause chronic infection and persist in the body for years. And just the respiratory viruses like flu and paraflu, RSV, etc., can persist and cause long-term symptoms. That viruses just can do that. The trouble with long COVID is completely poorly defined. There's a number of different diagnostic criteria, but they're all very, very loose. So we don't have a single tight diagnosis to be able to make this. So it's nothing like 5 or 8 or 10% of people that get COVID have long COVID. That's completely and utterly overstated. So there's a very small minority of people that have persistent symptoms. I'm not denying that, but a number of other viruses can do it as well. So look, for me, having been infected multiple times, I feel fine. I'm just getting old and tired and grumpy, but that's got nothing to do with the virus itself. It's just from working 70 hours a week and, trying to deal with all the other health issues that we do face. So I am not at all concerned, Ash, about Christmas or next year going forward. I don't see anything bad on the horizon at the moment, and the news is all pretty good.
Infectious diseases expert Dr Clay Golledge, always appreciate you sharing your insights with us. Thank you so much, and wishing you a very restful break to get over a big year. Thanks so much.
Thanks, Ash. All the best. Bye.